Sawasdee krap. Good afternoon once again. Today is Monday, the 10th of May, 2021. It's actually a public holiday today here in Thailand. I'll start off first with the daily statistics and numbers that we have for today. We have 1,630 cases confirmed for today. First good news is that the number is a little bit lower than the past 2 or 3 days. We have lower than 2,000 today. The first time in actually a few days past. The second good news is actually that we have a high number of new recoveries at 1,603. So the number of confirmed cases actually is slightly a little bit more than the number of new recoveries. So plus minus, actually only 27 new cases today added to the list because we have 1,630 confirmed cases and 1,603 new recoveries, as you can see on screen right now. Unfortunately, we have 22 new fatalities recorded for today, making the cumulative number of fatalities now standing at 421. Most of the fatalities today involve actually patients with chronic illnesses, diabetes, heart disease, for example. Many cases occurred among family members, friends, people having close contact with patients. So just a reminder that we must always comply with the various measures, specifically when we are with our family members and close friends. So just some observations from the presentation of Dr. Apisamai just now. First is that we see that the prospect of new infection in Thailand remains quite stable, with most cases now detected in Bangkok and nearby provinces. We've been talking about the various districts in the past days, particularly districts with crowded communities and markets, and for those people having contacts with patients who are already known to be COVID positive. In various other provinces in Thailand, the good news is that new cases are decreasing in the provinces. So Bangkok remains the hotspot. We see also a significant decrease in the new confirmed case today. So, however, we still advise, of course, everyone to remain vigilant. As we are waiting for the number of test results from the active case finding. As you recall, I mentioned about active case finding in the various districts of Bangkok. And there are still several high-risk areas in Bangkok. So Dr. Apisamai mentioned just now, and I'll touch on this a little bit, regarding the international arrivals, people coming in from abroad to Thailand. As you know, we have banned the arrival of foreign nationals coming in, particularly from India, since the 1st of May 2021. However, the repatriation of Thai nationals flying in from India is still going on and permitted. So this is particularly for the country of India because of the B.1.617.1 variant of Covid-19, which was first found in India. Now, for today's record, we have a number of people who traveled back from abroad and were tested positive. But of course, the good point is that they are put directly into the state quarantine system. Now, there is one person in particular who arrived from India. But however, this is a case that the arrival was since the 17th of April. And the detection of COVID was found around 10 days after that, and there was a slight delay in the relay of information. So therefore, this is not a case of a foreign national arriving from India after the 1st of May. This happened before May, just for clarification purposes. The Thai repatriation flights that we all know that is still going on from India. We have one that arrived on the 8th of May with 74 Thai nationals. And out of this number, we have 5 who were tested positive, and they were Thai nationals who lived in cities such as Chennai and Mumbai in India. So the B.1.617.1 variant of COVID-19, first found in India, is something that we're looking very close into. This is about the flights coming in of Thai nationals who particularly come from India. There was one particular case of a Thai female, actually, who traveled not from India but from Pakistan to Thailand on the 24th of April 2021 and confirmed to have the variant on the 9th of May 2021. But rest assured, she is in the state quarantine system. Now, about active case finding, authorities, as I mentioned, are conducting these missions in various communities to screen out infected individuals and provide appropriate treatment as quickly as possible. So the number of people tested by active case finding in Bangkok is approximately around 9,000 to 10,000 people per day. Fortunately, we see a significant decrease in new confirmed case. We have been seeing that trend a bit, and however, we are still advised, of course, to remain highly vigilant as we're waiting for test results in many active case finding areas. Also, AstraZeneca announced that the samples from test batches of COVID-19 vaccine made by Siam Bioscience has passed the quality testing at AstraZeneca's designated laboratories in Europe and in the United States. This significant progress means that AstraZeneca is getting closer to delivering the first batch of vaccines to Thailand, particularly the ones that have been produced in cooperation with the Thai side. So just in closing for today, there was a question posed to the CCSA, and Dr. Pisamai answered it just now. It was a question from the foreign media, particularly Phoenix Television from Hong Kong SAR. So the question from Phoenix Television was that about asymptomatic patients who could be permitted to go home after 10 days. So the answer to that query is that the latest development is that since the number of available beds in field hospitals is increasingly manageable to date, the asymptomatic patients will be required to stay in field hospitals for 14 days instead of 10 days and to remain in isolation for another 14 days after returning home. So they're placed into the field hospitals. So basically, this is what I have for you. I hope you enjoy the rest of the week ahead, and we'll see you again next time. Thank you for your attention. สวัสดีครับ